APGO Educational Topic Number 1, History. Welcome to the Obstetrics and Gynecology Clerkship. In this video, we will introduce you, medical student extraordinaire, to important aspects of women's healthcare. We will discuss unique history questions and risk assessments that we hope you will continue to utilize with your female patients in your future medical careers. The objectives of this video are to complete a comprehensive women's medical interview that includes menstrual, obstetrical, gynecologic, contraceptive, sexual, family, and social histories. To assess risk for unintended pregnancy, sexually transmitted infection, cervical pathology, breast malignancy, gynecologic malignancy, nutrition, obesity, domestic violence, and eating disorders. To assess the patient's adherence to the recommended screening measures. Demonstrate interpersonal and communication skills that build trust by addressing relevant factors including culture, ethnicity, language, literacy, socioeconomic status, spirituality and religion, age, sexual orientation, and disability. To produce well-organized written and oral reports to communicate the results of the OB-Gyn and general medical interview. Here is your patient, Wumina Healthowich. You are about to take a comprehensive women's health history of Wumina. What are the important elements? The physical environment is very important in order to enhance the quality of the interview. The interview should take place in a quiet, private, well-lit room and whenever possible with the patient dressed. Possibly intimidating instruments should be covered. Remember how important it is to greet the patient by title and name, to make eye contact, to shake hands, and to be welcoming. Be aware that the presence of family members may be an impediment to an honest interview, especially in cases of intimate partner violence. The help of a medically trained interpreter should be sought for patients who need those services. Family members should ideally not be used for translation because of privacy, confidentiality, bias, and the sensitive nature of many women's health issues. Let's start with the menstrual history. Find out her menarche, or the age at which she started menstruating. Find out how regular her periods are. Find out how heavy her periods are and what was the date of her last menstrual period. Why is this important? Let's take a quick trip to the land of primary care. What if Wumina was seeing you for headaches and you neglected to ask her about her periods? Would this be relevant if her periods were extremely heavy to the point that she was very anemic from her bleeding? Or what if Wumina had very light, very infrequent periods? This would suggest that an evaluation for a prolactinoma should be included. Or what if you were seeing an obese young woman who had a borderline fasting blood glucose and you discovered that her periods are extremely irregular? This constellation of symptoms should make you think of polycystic ovarian syndrome. Let's move now to gynecologic history. Ask if she has any known gynecologic illnesses. The gynecologic history includes the sexual history. It is important to use open-ended questions, such as,
"Please tell me about your sexual partner or partners."
Why is this so important to ask open-ended questions? Let us imagine a few possible scenarios. What if Wumina was a lesbian who was seeing a gynecologist for the first time? On her intake form, she marked that she was sexually active and not married. If you immediately ask her what birth control she is using, and then spend time counseling her about contraception options without first asking an open-ended question, this could be perceived as culturally insensitive. Asking open-ended questions also allows Wumina to feel that she can be open, so you can better assess her risk of sexually transmitted infections. Contraceptive history. What is her risk of unintended pregnancy? Anyone sexually active with men without a contraceptive plan is basically at risk for unintended pregnancy. Remember that the United States has the highest rate of unintended pregnancy in the developed world, with approximately 1/2 of all pregnancies being unintended. Also remember to ask about prolapse and incontinence. Many women may be embarrassed by these conditions and may not mention them unless you specifically ask. Moving next to her obstetrical history. This includes the gravidity, which is the number of pregnancies, and parity, which are the pregnancy outcomes. The parity can be further described as the number of full-term, preterm, abortions, and living children. The acronym TPAL can be useful for remembering these different aspects. Of note, abortions refers to both terminations and miscarriages. Next, we'll move on to family history. You should find out which illnesses occur in first-degree relatives such as diabetes, cancer, osteoporosis, and heart disease. Information gathered here may indicate a genetic predisposition for a hereditary disease such as breast or ovarian cancer. Let's now move to social history. It is important to ask about tobacco, alcohol, and illegal drugs. In the United States, approximately 21% of all women use tobacco products, 16% of women older than 12 are binge drinkers, and 11% of non-pregnant women aged 15 to 44 report illicit drug use in the past month. The social history is also an important time to screen for sexual abuse and intimate partner violence. These two issues are unfortunately too common in our female patients, and we as healthcare providers need to improve how well we screen for them. The radar approach is one way of addressing intimate partner violence with your patients. R. Remember to ask routinely about intimate partner violence. A. Ask directly about violence with questions such as, at any time has a partner hit, kicked, or otherwise hurt or frightened you? D. Document information about suspected intimate partner violence in the patient's chart and file reports when required by law. A. Assess your patient's safety. Is it safe to return home? Find out if any weapons are kept in the house. R. Review options with your patients. Know about the type of referral options that are available, such as shelters or support groups. When we discuss a patient's adherence to recommended screening measures, it is important to think about health literacy. This is the ability to understand instructions on prescription drug bottles, appointment slips, patient education brochures, consent forms, and the ability to negotiate complex healthcare systems. 10% of Americans are estimated to have low health literacy, and 50% are estimated to have marginal to low health literacy skills. Adults with low health literacy are at increased risk of hospitalizations, encounter more barriers to receiving necessary healthcare services, and are less likely to understand medical advice that can affect disease progression. It is important for healthcare providers to be able to assess a woman's health literacy to provide appropriate instructions and explanations about her care. Health literacy is one of the important aspects of effective communication that should take into account culture, ethnicity, language, socioeconomic status, spirituality and religion, age, sexual orientation, and disability. It is important that you produce well-organized written and oral reports to communicate the results of the OB-GYN and general medical interview. We will conclude this video with tips and tricks that will help you throughout this clerkship and beyond. Obstetrics and gynecology is a surgical specialty, so the general expectation will be that written and especially oral reports should be concise and focused. It is important to take a complete history, however, remember to focus on the pertinent positives and negatives. For example, most of our patients on labor and delivery are young, reproductive aged, and generally very healthy. In this world, the G's and P's, and especially the mode of delivery of prior pregnancies, will be important to include. So if you are presenting someone who is admitted with active labor, prior contraception, for example, may not be the most important point to emphasize in this presentation, but contraception will be an important point to highlight in a presentation about a postpartum patient. Remember that the assessment and plan are the important aspects of the written and oral reports that medical students often struggle with. Get into the habit of developing an assessment and plan for every patient that you see during your clerkships. This is one of the critical steps in becoming a skilled clinician. This concludes the APGO video on history. We hope that you feel better prepared to perform a comprehensive women's medical interview and to demonstrate interpersonal and important communication skills.